here for all of our conference, then welcome back. If this is your only day, then welcome. It's been an amazing conference so far, and we're just feel so blessed for all the speakers who have been willing to share their wealth of knowledge with us. And now I'd like to invite our very own Cheryl Shantz for a reflection.
In the book Boundless Compassion by Joyce Rupp, she states there are three movements of compassion: awareness, attitude, and action. She also states there are four spiritual qualities for compassion to grow: non-judgment, non-violence, forgiveness, and mindfulness. Paul commands us in Colossians 3:12 to clothe yourself with compassion, or another translation says to put on compassion. It is something we have to actively do. Paul Gilbert states that what we focus on, aspire to, and practice will make a difference to our brains. And Jack Kornfield states what we repeatedly think shapes our world. This conference has made us aware of many problems in areas where compassion is needed. With the help of God, we are capable of changing what we think and how we respond, to change our attitude. Now it is up to us and the divine in each of us to move us to action. I'll close by reading a prayer by Joyce Rupp. Spirit of love, you faithfully stir my heart and inspire my mind to think compassionately. I thank you for continuing to lead me toward a desire to be a more loving human being. I pray to activate the following intentions. Be aware of what tries to lessen my kindness. Choose to develop a compassionate presence by widening my mind and expanding my heart. Allow false thoughts and pretenses to crumble. Stretch past each unkind judgment that arises. Become attuned to where my resistance resides. Let go of harmful attitudes and useless fears and wash away excessive immersion in myself.
Re-registering all this stuff over here.
Spirit of love, keep gently persuading me to grow so ever more of who I am reflects your love. Like charcoal clouds departing the morning sky, let whatever fails to reflect compassion drift away until my life reveals a wide sky of loving kindness. Amen.
Thank you, Cheryl. That was beautiful. Always, Joyce Rupp is so good at putting into words what we can't say. And so thank you so much for that. I'd like now to introduce Vanessa Burke. She's going to announce and award our 2025 award recipient. She's going to present the award. So Vanessa.
Good evening, afternoon.
Vanessa, I accidentally muted you.
Shame on you, Terry.
I know.
Good afternoon, everyone. I'm so happy to and honored to do this particular task today. Our first award is the Norma Small Outstanding Coordinator in Faith Health Ministry Award, which recognizes a distinguished health ministries coordinator and HMA member. The nominee demonstrates a resourcefulness to implement change through significant innovative teaching strategies which respond to diverse needs within faith communities and health systems. This award is in memory of Norma Small, PhD, RN, whose leadership and vision continue to inspire excellence in faith-based health ministry. The 2025 recipient of the Norma Small Outstanding Coordinator in Faith Health Ministry Award this year is Deb Fell Carson. Deb exemplifies the spirit of this award through her transformative leadership as Executive Director of the Faith Community Health Network, a nonprofit she founded to equip and support faith community nurses and health ministers across Oregon and beyond. Her visionary coordination has united nurses from varied faith traditions to promote whole person health, advanced legislative change for community-based nursing reimbursement, and expanded educational access through the online delivery of health education programs, including the Westberg Institute's Foundations of Faith Community Nursing course. Her inclusive teaching methods, collaborative approach, and commitment to addressing diverse spiritual and cultural health needs have strengthened faith health partnerships at local, state, and national levels. Through her innovation, advocacy, and unwavering faith, Deb Fell Carlson continues to embody the legacy of Norma Small, bridging healthcare and faith communities with compassion, creativity, and transformative leadership. Our next award is the Westberg Leadership in Faith Community Nursing Award, which is presented to an outstanding faith community nurse and HMA member. The recipient is recognized for significant contributions in advancing the practice of faith community nursing within the faith community. This award is in memory of Reverend Dr. Granger Westberg, a pioneer of faith community nursing and the concept of the integration of faith and health. The 2025 recipient of the Westberg Leadership in Faith Community Nursing Award is Frances L. Hawkins. As Vice President of BCM's Congregational Wellness Division, Nurse Hawkins oversees a network of more than 200 faith community nurses and congregational health promoters, serving over 100 churches in the greater New Orleans area. Her leadership has guided evidence-based programs that integrate faith and health to promote whole person wellness, address chronic disease, and strengthen community partnerships. Among her notable initiatives are strategies to trim and reduce, or STAR, a program improving weight management and blood pressure control, and the Behavioral Health Initiative for Pastors, which promotes self-care and mental well-being among clergy. She also led mental health first aid training efforts in collaboration with the National Council for Mental Well-being, equipping over 150 faith and community leaders with essential mental health response skills. A certified faith community nurse and active member of the Health Ministries Association and American Nurses Association, Hawkins exemplifies compassionate service, professional excellence, and visionary leadership. Her work continues to inspire faith community nurses nationwide to build healthier, more resilient congregations grounded in the principles of holistic care. Let's give them a round of applause, both Deb and Frances. We will now take a couple of minutes to hear from each of our awardees. I'm going to ask the recipients of these two prestigious HMA awards to unmute themselves. We will start with Deb and then Frances. Deb?
Okay, I love to talk, Vanessa. I'm
Deb.
glad you gave me a limit. I just want to say that I am deeply honored to have been selected for this award in memory of Dr. Norma Small. I was reading about how she always listened to God's whisper and made things happen to move faith community nursing forward in so many ways. But I was really surprised to see so many overlaps in our journey. So she was in the Army Nurse Corps, served for over 20 years, and so was I. She dabbled in occupational health nursing. I saw an article in the OHN Journal, and I spent much of my career in occupational health nursing and then retired without pay. And that's when I'm actually doing more, I think, spiritually fulfilling work as she did in my retirement, which actually looks nothing like retirement at all. And I just so wish I could have met her. I'm honored to think that someone thought of me in the context of her. And I love her courage that just comes from listening to the Holy One's lead. And I can only just prayerfully hope that I can move forward in our work with that same listening to God's whisper along the way. And I just am so thankful for this.
Thank you, Deb. We applaud you. Thank you so much for being who you are in HMA. Francis,
Under
if
2
you could
minutes.
unmute yourself.
Do you hear me?
Okay, we hear you now.
Okay, the Faith Community Nurse Award. I thank the 2025 HMA Award Committee and this year's HMA Program Committee and the HMO Board of Directors. The work that is exemplified or acknowledged today would not be possible without dynamic professional women of excellence in congregational wellness at Baptist Community Ministries and contributions from the late Dr. Myrna Casimir. I am blessed beyond belief to have such a team and volunteer network of nearly 200 churches, over 400 trained registered nurses and congregational health promoters that implement programs that are faith-centered and significantly influential in the community. They're spiritually integrated in a holistic approach to the health promotion. Through the support of our CEO and executive leadership, we have implemented change and achieved significant improvements throughout the community using creative approaches and evidence-based practices. Being a faith-based Christian organization operating within a 5-parish area, we are deeply rooted in our core values of faithfulness, compassion, and respect. My daily affirmation is heard in the words of an old spiritual song from Mahalia Jackson that states, if I can help somebody as I pass along, if I can help somebody with a word or song, then my living shall not be in vain. Thank you all, and God bless each of you.
Thank you, Francis. Thank you so much. So let's go ahead and give a round of applause to Deb and Francis once again. And we really are just excited about the work you've done. And we look forward to more times of collaboration and work in the future because there's still so much to do. Okay, everybody can mute themselves. Julie, Terry, take it away.
So really quickly, before I prompt myself to do the next introduction, I just want to thank the nominating committee also, who worked so hard, the awards and nominating committee who worked so hard. And that would include Nikki Eyre, Deborah Vard, Karen McDonald, Nancy Durbin, and am I missing someone? I think that's it. And we just
That was it, Julie. And I was
Okay.
simply advising as the former chair. Y'all did a great
Does it-
work. Thank you,
does
everybody.
it matter? You work hard. So, and I just would like at this 2 seconds to say, if you're interested in this committee next year, please reach out to me. It's not a ton of work, but it really helps us to encourage people to give awards out to the ones who deserve it and who are doing so much work behind the scenes and sometimes don't get noticed. So that's my 2-minute plug. So now I'm really honored to introduce our next speaker, Bev Bateman. I just also want to say that it's so cool that Bev is from Alaska. I just think that's the coolest thing ever because I've never been and don't know anyone from there. So I love that she's there in the true north of our speakers. So with over 3 decades of professional experience, Bev Bateman brings a rare and powerful blend of clinical expertise and spiritual leadership. As a registered nurse and ordained elder, she has dedicated her career to advancing whole person health in faith communities, bridging the gap between healthcare and ministry with compassion, innovation, and clarity. She is passionate about bringing whole person health to faith communities and their leadership with her excellent communication skills and her innovative and collaborative approach. Bev has successfully led initiatives across diverse educational and healthcare environments, including regulatory programs like meaningful use and promoting interoperability. Her work reflects the principles of the Institute for Healthcare Improvement's quadruple aim: enhancing care, reducing costs, aligning with organizational strategy, and restoring joy to the healthcare workplace. Let's welcome Bev Bateman.
Good morning and thank you. It is definitely Alaska here today. We are sitting at about 29 degrees and have no snow on the ground yet, but we are enjoying the shortening days, if you want to call it that. The sun came up about 9:30 this morning, so it'll be up for a few hours and then it'll go back to sleep. So it is definitely different. We first moved to Anchorage and, you know, that's in Alaska. But when we moved to Nome, we arrived in the real Alaska, as I refer to it. So it has been a definite experience. Here's just a little bit about me. You already heard a lot about that, but want to get into, when I first saw the title for the meetings, I was like, oh man, I'm going to have to apply for that for the True North, because maybe there's not very many people in Alaska that are doing this. And so one of my passions is documentation. And if you know me very long, you'll begin to pick up on that, because I believe that that is one of the foundational things that will move us forward as a specialty. We have got so much to offer to healthcare, especially in today's world. But I think we'll find through the presentation that's not something new. Nurses have been offering a lot to the community of healthcare throughout history. So we're going to take a look at 3 objectives this morning. True North number 1 is why documentation is part of the FCN's DNA. And some of this, I'm sure, will just be kind of, you've heard it before, but I want to bring it back to the front of your mind as we think about today's world. True North number 2, what FCNs need to document and when. And I tried to put a little twist on this for the North emphasis, so we'll see how that goes. And then True North number 3, how FCNs can bring continuity of care to a higher level through technologies, including artificial intelligence. And there is lots of conversation about this. There is not enough time in the day for us to delve real deeply into this, but we'll catch a little overview of it. And if you have questions, we can always explore things further. So why documentation is part of the FCN's DNA? Well, if we go back to our history and some of our roots, and we have many roots, but one of them is Florence Nightingale. And I think remembering our calling is where we have to start. She said, I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. And here we are at some of the very core ethics and morals of our profession, which has been for years now the most trusted profession, except for the 1 year when 9/11, the firefighters were trusted, and for good reason. But now we've returned to that most trusted profession, and that instills in us some needs to make sure that we are practicing faithfully. So a few key points from Florence include that she emphasized the importance of documentation for improving patient care and advocating for change. She believed that collecting and analyzing data was crucial for evaluating conditions, identifying problems, and implementing effective reforms in healthcare. Nightingale was critical of the poor record-keeping systems she encountered, particularly at Scuteri. She believed that accurate and comprehensive data collection was essential for understanding and addressing healthcare issues. And I think if we take a minute and think about that, some of the research I've done into how faith community nurses document and how faithful they are at it indicate that there is a large percentage, like 32% in a recent survey, said that faith community nurses reported that they never documented. And I think that's very, very concerning on multiple levels. But let's explore further what Nightingale saw. She saw data collection as a way to measure the effectiveness of treatments, identify areas for improvement, and advocate for change. She was a pioneer in evidence-based healthcare, using data to demonstrate the impact of environmental factors on patient health and morality. She used charts and graphs to visualize data and make it more accessible to policymakers and the public, essentially pioneering the use of infographics. She stressed the importance of nurses being keen observers, noting that, quote, the most important practical lesson that can be given to nurses is to teach them to observe. Nightingale believed that documentation should be a tool to improve patient care, not just a formality. She emphasized the need to document details about the patient's environment, such as ventilation, light, cleanliness, and diet, to ensure a holistic approach to care. Nightingale used her data and documentation to advocate for improved sanitation, healthcare policies, and ultimately to improve patient outcomes. And that's what we're all about. That's what we're concerned about, the patient outcomes and patient-centered care. So nurses document to ensure continuity of care, facilitate communication among healthcare professionals, provide evidence of nursing interventions, and protect patients and nurses from legal and ethical issues. Good documentation is a core component of nursing practice, demonstrating evidence-based decision-making and adherence to professional standards. We want to remember that the professional standards include where we start with our nursing scope and standards, the 4th edition. Each of those standards has a related to the nursing process, includes a competency regarding documentation. And standard 14 itself as the quality of practice includes a competency of documentation. Further, our own specialty standards of care, scope and standards of practice, each of those standards includes that documentation piece. And State Board of Nursing Nurse Practice Acts. We're each from a different state, and I challenge you all to go and take a look at your Nurse Practice Act, and if you can find in there that it doesn't talk about documentation, let me know, because we probably need to talk to them, because it is so important. And in the words that Jean-Luc Picard used, I think that Florence Nightingale would tell us to make it so. We just need to document because it's the right thing to do, and it supports our nursing profession. So let's think about what we need to document and when. And again, I mentioned that we're going to take a walk through North. So I developed this navigational optimal records through holistic documentation, or North. So let's see what we can do with that. N stands for narrative clarity. We need to use precise language and avoid jargon and ambiguity. And we reflect on clinical reasoning. So as we think about what it is we need to document, and unfortunately at this point, I'm a big advocate for electronic documentation, but as many of you know, the last electronic faith community nurse documentation system went offline or is going offline very soon. And so we are in a big world of hurt. We need electronic documentation that can help us with some of this. But in the meantime, a lot of us learned on paper, and we can make it happen. So we need to be clear in our narratives. Observations are important. Our vital signs, symptoms, and changes, what we see going on. This supports the continuity of care. To be able to share a report that the healthcare consumer can take to the provider with them, that has a record of the blood pressures that we have taken, that shows other care that we provided, so that we can be a part of that continuity of care and a part of the greater story for that person's health. And real-time entries, that's so important that we get it down as soon as we can, so that we have the accuracy and the complete story. So we're narrative clarity, observations first, and then relevance and rationale. We focus on pertinent data. We don't have to write down every little thing, that the black and white dog was in the living room on the sofa, but we do need to be very focused on the pertinent data and explain those clinical decisions that we make. Why is it that we went with them to the provider? Are there concerns about their cognitive ability? Or was it just the fact that when we go to a provider, sometimes we need another set of ears to help us hear and then explain what it was we heard? This all supports legal and ethical standards, as we talked about. And to date, we don't know of any faith community nurse that has been involved in legal procedures, but we don't want to get there. And documentation is one of the things that can help us along the way. Timeliness and truthfulness. We document care as it happens. We avoid backdating or speculation, and we maintain integrity and accountability. When we do these three things, we can count on our documentation being what it needs to be. For H, we had to get a little bit fancy, because we wanted to add a W, because we are about holistic care. But the H brings us to the physical, emotional, spiritual, and social aspects. And our documentation needs to reflect that patient-centered and culturally sensitive care that we provide. And we support interdisciplinary collaboration. So when we think about this, there's tools that can be used for spiritual assessments, like hope, like I just lost the thought of the other one. But anyway, as we use those tools, it also helps us discover what the patient may need, what our healthcare consumer that we're working with may need in the area of other things. Because spiritual is so intertwined in life. And my position is that we can't be healthy in one area and unhealthy in all the others. We have to, as a whole person, be striving towards health. And there will be degrees, but as we do that, we can understand. Other things we need to take into account are ACEs, the adverse childhood events that occur. We need to think about the social determinants of health, the impact of their home. I was reading several of Florence Nightingale's books, or books about her, over the last couple of years. And, she was very, very big on what the environment was like. Was there fresh air coming in? Even if it meant opening a window in the wintertime, there must be enough air exchange to help with the health of the person. Other social determinants of health are, in our day and age, we think about food insecurities. We think about housing insecurity. So all of those things, we need to have that holistic view, and we can come back into our documentation. And it doesn't take paragraph after paragraph usually, but if we can put down our observations that says, we notice that the front steps, for the patient was hard for them to get up and down. So maybe consider a ramp. So some of those one or two sentences is all it takes. Consistency in getting it documented and then being able to share that documentation with the providers that can assist is the bottom line of the need. So we want to talk a little bit about how FCNs can bring continuity of care to a higher level through technologies. And I mentioned a little bit of the AI, but in general, the use of AI in everyday life or healthcare isn't new, but it's come to the forefront of our conversations with the OpenAI's Chat GPT that began in November of 2022. And I don't know if you've played around with that much or if you use it religiously every day, but I just happened on to using it in the last year. And it's quite interesting, the things that it'll do. And my daughter, who's into IT quite a bit and is a mental health professional, actually built a few questions and had people put into it. And if you've used it at all, the questions that she had you ask put in actually had a lot of real answers and knew a lot about you. So it was very scary to think about how much the computer could glean from questions you've asked it, comments you've made to it in the course of time, and then put together a composite that kind of was almost too true to what you were. Well, the National Institute of Health defines AI as a feature in which machines learn to perform tasks. Been watching a series in the evenings with my husband, and they have built an AI person and looks just as human as it can be. And of course, it is a human being in the actor, but the way it's growing and learning is just amazing. And after the little bit of AI that I've played with, I certainly could see how that could be real. So the National Science Foundation notes that AI enables computers and other automated systems to perform tasks that have historically required human decision-making abilities. So this can be concerning on many levels, because what happens when the machine makes the decision rather than the human being? And so as we look at things, we know that with good and evil in the world, with those who want to use things negatively, this is an opportunity. But I'm also careful, because this is an opportunity for very many good things as well. And some of those that we've seen come along, it's not new. In fact, it's currently used in many ways that are relevant to us. If you think about it, automated blood pressure machines, they've been around a long time. We used to have to put a cuff on and listen with the stethoscope, and depending on how acute our hearing was, maybe, and where things were placed and how far we pumped it up, we could get different readings. True of automated blood pressure machines also, but the decision making, was that at 130 that I heard that, or was that at 132 that I heard that, is taken away, because the automated blood pressure machine makes that decision. Same with digital thermometers. Remember when we had to shake down the mercury and try to make sure we were reading those fine print correctly? Now we have digital thermometers that tell us exactly what's going on. And I'm sure you could think of some other examples if where we see decision making being done. Clinical decision support is something that's made use of quite a bit in hospitals nowadays, and they will look at lab results. One of the big places this is used is in septic diagnoses, as the computer looks at vital signs, at lab results, at questions that were answered in the course of the assessment, and puts together and says, hey, this is a person who might already have it or might be at risk for this, and helps us identify earlier that there is sepsis in this person's future, possibly. So very good things where the computer can look at a vast amount of data and pull it together in a way that it would take human beings a lot of time and effort. Another piece is the mobile health and sensor-based technologies, so like heart monitors, able to see that rhythm, O2 sensors, and then voice assistants and robotics like Dragon Medical dictation software, which a lot of providers use within the electronic EHRs. And these allow providers to just be able to use their phone as a note taker, and they can dictate into that software and have their notes down. And guess what? When we're looking at the EHRs, we don't have to try to figure out exactly what it was a provider wrote or another nurse or caregiver wrote. We can read it because it's actually typed in there. So those days of trying to figure out for sure how many milligrams the medication was is gone. Now, if the system can't capture it correctly, the provider has to take care of it and make sure that what they want and are ordering for the patient is correct. So nurses should be involved in the conceptualization, development, and implementation of AI, especially when it impacts nursing practice. And I spent many years in that field on the front edge. Patient care monitoring systems, for instance. Oops, excuse me. The cameras can be used in the homes of the elderly to assist monitoring their safety. And there's always concerns about privacy, and those are very valid concerns. But there are ways to make use of technology today. We see it in the buttons that people can wear. I've fallen and I can't get up was one of the early ones. But nowadays, when we do have cameras, there has been use of those even in long-term care facilities by families, so that they can drop in and talk to the person, the resident, kind of like FaceTime is now, but the resident doesn't have to do anything except respond. So it makes it very, very reassuring for families that are able to make use of that. So according to the Code of Ethics for Nurses with Interpretive Statements, advanced technologies, including AI, do not replace nursing skills or judgments. And that's a big reminder. As we're looking at patient-centered care, we cannot depend on the computer to do our care or to replace our gut when we know what it is through critical thinking that needs to happen. We always need to remember this and to be sure that we don't rely on machinery. One of the things that we look at in inpatient settings is don't read the machines, do read the machines. We get both messages, but we understand that if there's a question of what we're seeing or hearing, the two going together, if we listen to the chest and can hear that beat and know that it's picking up correctly, we can go back and forth and we can confirm both ways. So it doesn't replace the critical thinking or the nurse's job to be able to use those skills that we've learned. Integration of AI in practice must not alter the goals of patient care. And like I said, those goals are patient-centered care. What is it that the healthcare consumer wants? How do they want their care to go? What do they need? What are they asking for? And sometimes we have to help them discover that. But as we think about what AI can offer us in the faith community nurse realm, it takes a little bit more imagination. It's always been my imagination that someday I can just have my phone or whatever device it is and I can just walk in and I can talk to the patient, to the healthcare consumer that I'm working with. And as I make observations and assessments, it would just take it and it would just feed it into this nice little note and fill in all the blanks. Wouldn't that be great? So we didn't have to actually sit down and document. That's a dream world for sure. But I don't know that we're terribly far away from that in some ways. And that's one of the things as we look at building electronic documentation for faith community nurses, we want to be able to look at how can we incorporate some of these AI technologies and the advancements that we have that will help us to be able to spend our time really intentionally caring for the spirit and looking at that whole person need and be able to document as we need to, but have AI take care of things, have technology take care of things that it can take care of. So we've thought about why documentation is part of the FCN's DNA. It has been important since the beginning. We cannot not document. The idea that I'm retired now is not a good reason not to document. It's part of a nurse's call from beginning to end. And when we expand it into even healthcare assistants or associates or care providers that help us along the way, there's a need for them to document as well. What we're doing here is a service, and it's an important part of the healthcare story. And I think as we allow ourselves to elevate into the practice at the top of our licenses, which is what faith community nurses do, we have to come alongside that with documentation to make sure that we are meeting those needs. And what we need to document and when is, well, we do need to be timely, but we need to be clear. Our narrative needs to be clear. Our observations need to be concise, and our assessments need to be broad. We're looking at whole person health, not just one area like many specialists do, not just the spiritual needs like we would typically see from the spiritual care center or the faith community. We're looking at how can we reach whole person health. And R, you all hang on here. We're going to go back to the R just real quick. Relevance and rationale. So again, to remember that we need to be relevant, rational. We continue to use our nursing critical thinking skills, and we explain our clinical decisions. T, timeliness and truthfulness. Document, avoid, maintain. Document as the care happens, avoid backdating and speculation, and maintain integrity and accountability. And H, holistically, that whole person care, what it's all about. We'll flip forward again real quick here. And then third, how can FCNs bring continuity of care to a higher level through technologies, including artificial intelligence? I would say that the possibilities are endless. And so as you walk through care that you're providing and each day as you're working with patients in the faith community health, faith communities, think about how can, what if, dream a little, and then share that dream. You can go out to the Westberg Sharing Foundation and be able to share the ideas. We have a technology site there, but just let it soak in. What possibilities are there as we look at building a documentation system that will meet faith community nurse needs and be able to draw us all into the ability to share the care, be a part of the patient's whole health, not just whole health in themselves with working between us, but their whole healthcare picture. So I am at the end of my presentation. I'm a little bit early today, but I don't know if we want to have any time for questions. I think that's going to be a little later on.
Well, we have like 2 to 3 minutes for questions, Bev.
Okay.
And we do have one in here. Actually, I want to make a comment first because not only am I a faith community nurse, but I am a health minister. And I will say to those who are health ministers, there is no reason why you shouldn't be documenting. And I see Reverend Karen McDonald shaking her head. This is something you do. And I'm sure, and I'm speaking for Vanessa, and this isn't polite, but as a social worker, she is also doing that. So as health ministers, we need to be conscious of documenting accurately. And as you described, the whole person documentation. And saying that, Marianne had a question in the chat. With the Henry Ford documentation system going away, how are we to document? Is there a replacement?
Right. Excuse me. And I've gotten a lot of questions about this. There isn't a replacement at this moment. For the last couple of years, I've been working on a documentation system. There is a survey out now. I don't know if you've all been able to see it and join in or not, but it is about documentation needs and trying to gather things. We have a prototype. We're trying to find funding. So the goal is to have that there, and it will have modules so that you can use what you need, with the basic one being documentation in a much friendlier and simpler form than any of the EHRs that are out there today. I refer to the big three: Epic, Meditech, and Cerner. We don't need all of the pretties and the extras and all of that kind of stuff. We just need a basic way to be able to share the story. And my view, because of where I live in Alaska, is we'll have a website available where you can go in through a portal and document there. But we'll also have an app available where if you're out and you don't have connectivity, it will hold that data until the device that you're on reconnects. Because for us anyway, it's very important that we don't have to double document. I don't want to have to put it in once and then again when I get back where I have connectivity. So that's a piece that's a little more expensive, but we're looking at how quickly we can get some turnaround so that we have some type of electronic health care record to be able to offer for use for faith community nurses. Have a meeting later this week, which that would be tomorrow now. This is Thursday. So with a programmer to see where we're at and what the dollars are now, and just continue to look at how can we get this out there. I would say if he started tomorrow, it would be 6 months out, based on what I've known before, to get the website set up. It'll be a little bit longer than that for the app, but if we could at least get that basic ability on the website, that would be just wonderful.
So, and Reverend Karen McDonald asked, will it, can HMA make it available to members when you get it up, and we can coordinate with this?
That it's certainly, there's Westburg HMA. I have a nonprofit that has that where we've been working at it before up till this point. Whatever. I am not, trying to make a bunch of money. I just have this, like I said, in my heart that we need this. We needed this before, because I want it up to date, and all of it has been the other two that were out there along with Henry Ford have been dated. I want to get it up to date where it's very easy to use, has a good robust reporting, both for being able to print out a patient visit summary similar to what you'd get at a doctor's office, so that the healthcare consumer can take it with them, but also monthly reporting. Here in Alaska, I asked my faith community nurses to report monthly on what they've done. Of course, that's not patient specific, but how many were in the class you taught? What class did you teach? And some of those things. And I've been having to report to our executives here at the hospital to be able to continue with the department. And so far we've been well, I'm still employed, so I'm happy about that. So
we are too, Bev. So can
those monthly reports are important as well.
Okay, so you'll join us for the breakout rooms at the end of this day. So keep
Yes.
that in mind, everybody, to come back and if you have questions for Bev, to visit her. So we are going to take a break till the very top of the hour, and we are going to start on a timely basis because we have a lot to do today. So glad you're here, and I will put on the recording for now.
Introduce to you our next speaker.
Yes, welcome everyone. It's so good to see you these last few days. It is my pleasure and honor to introduce Vanessa E. Burks. Vanessa has been employed by Baptist Community Ministries for 25 years. She is the program manager for its Congregational Wellness Division. As such, she oversees the planning and organization of 2 behavioral health programs. The Behavioral Health Initiative for Pastors program, which focuses on promoting self-care and mental health care among pastors, their spouses, and children. And number 2, the Mental Health First Aid Certificate Program, where she is a certified instructor and coordinates the development of mental health programs in churches that have health and wellness ministries. Ms. Burks has been associated with the Health Ministries Association since the early 2000s. In 2008, she was the network chairperson for clergy and chaplains. And in 2020, Vanessa was elected to the HMA board and became vice president in 2022 and 2023. She currently serves as the president of HMA, and she serves as the first African American president of the association and the only and second to none non-nurse in that position. Welcome, Vanessa.
Thank you, Carrie. Thank you so much. I'm so happy to be here. And we're going to start off the presentation today with the annual meeting. So I therefore call our annual meeting to order for 2025. Thank you, Karen. So I'm going to share my screen. Let's see.
So if I call your name at any time during this meeting, please hit the reaction button a couple of times so people can see who you are, whether you are an established older leader in HMA or a new leader in HMA.
So, can you all see my screen?
This is working, yes.
Okay, and you
Yeah, sounds better too.
Okay, great. All right, so I want to move on to our achievements and our milestones. So let me make sure that I am on the screen as well. Okay, so one of our first achievements is what we're experiencing right now, hosting the 35th annual HMA conference. That's a big deal. We do this conference once a year, and it's been, it's different from an in-person conference, of course, but what we've done in the virtual conference has been such a boost for HMA in many ways. This conference is a one-time each year that we have the opportunity to come together, learn, network, and share ideas. And I hope you've been hanging around to dialogue with the speakers in the breakout rooms after the sessions over the last few meetings. We want to use those meeting after the meeting opportunities to connect and to bond. So great big thank you to Terry Helton, the conference committee chair, and her team for doing the work that we've been enjoying last week and this week. The conference committee members include Julie Ruknevich and Gornick, Donna Kramer, Helen Backwanden, and myself. Nursing Scope and Standards of Practice. The 4th revision is on sale now. To date, we have sold 400 copies. That was a couple of weeks ago, so maybe we've probably sold more by now. So as you know, Nancy Romanchek led a team of people to get this revision to print. And so we acknowledged those folks last year, and it's done. And our nursing scope and standards of practice is on sale. The Lenten season book review. The book review sessions have brought us into such spiritual focus and has fed our souls and undergirded us in our faith to continue the important work that we do as faith community nurses and health ministers. These sessions have also been touch point opportunities to shepherd people into committee and leadership roles. We are thankful. We're thankful for those who have participated in the Lenten season book review, and I will mention the leaders of that initiative in just a moment. But let's move on to our Faith Activity and Nutrition Program, or FAN. Big shout out to Denise Vicker for shepherding that program. Denise has kept HMA involved in FAN, which has benefited HMA financially and has been a valuable resource, has made valuable resources available for faith community programs and the people that they serve. Pam Hurley, in particular, one of our board members, reports that her organization, Atrium Health, Faith Community Health Ministry, established a 2025 goal around the FAN program. So they have a team lead who has learned the modules, and the program has been introduced to other staff and participants. And they now have 4 faith communities enrolled in FAN. So Pam also said that they will provide a link to the FAN info on all of their intro materials as new nurses and new health promoters come on board. So this is awesome. This is awesome and so satisfying to see that an HMA member is utilizing the program, and we are excited to hear more about its impact in the Atrium Health Ministry where Pam serves. And then our website has been updated. A big thank you to Julie, our executive director, for all her hard work in facilitating the update of our website, along with our website consultant, Jessica Vesper. And if you haven't seen the new website, you should see it. You have to go see it. It's well organized, so fresh, so clean, so crisp. It looks and feels like good health. So thank you to Julie for that. And I want to mention our regional meetings. They're ongoing. They're happening regularly. We have new leadership in the Pacific region. Bev Bateman is leading that region. You just heard from Bev in the previous presentation. Thank you, Bev, for stepping up. Our other regional leaders are Nikki Ayers, Liz Collins, Helen Bagwanden, and Kathleen Zagata. I hope you all are doing your hearts and your thumbs up when I'm calling your name. I want them to know who you are. Thank you, thank you, thank you, regional leaders, for the work you are doing. Your work is vital. Your work is vital because regional meetings can be a gateway to membership as well as a pathway to collaborating with other national and regional groups. And we have some ideas about that in the near future, of which we will keep you posted, keep you abreast of those as plans develop. Nikki Ayers is also a new leader on the awards committee this year. Thank you for stepping up. We appreciate it. Shout out to Reverend Karen McDonald. She said she was only in what she said, an advisory role, but thank you, Karen, for taking on that role. Nancy Durbin, Deborah Rivard, and for serving on that committee as well, the awards committee. And then Lisa Collins and Frances Hawkins. Lisa Collins and Frances Hawkins served on the nominating committee. Thank you, friends. I appreciate that. Even though Karen and Frances were slated to roll off, these leaders saw the need, they realized there was a need, and they extended themselves another year. And then we have three new people serving on this spiritual leadership committee, or they may not all be new, but they re-upped for another year, as the military would say, they re-upped. Amy Armanius, continuing her leadership since leaving the board last year, now on the SLC, and Beth Cook and Donna Kramer also stepped up into leadership by hosting our second virtual Lenten book group this year. And so we thank all of those people for serving on all of the different committees. We also want to mention the membership role has been updated. Thank you again to Julie, who spearheaded that effort, along with Carrie Moody, our VP, and Gornick, our spiritual leadership director, and Denise Vicker, our past president, and myself. We all played a critical role in getting our membership data caught up. It's a work in progress, so please be patient with us as we continue to gather information from some of you to ensure that our records are accurate. I want to, speaking of membership, I want to talk about this report that I researched. I did a little research, and according to a 2023 MGI membership marketing benchmark report, 49% of associations are growing. 49% of associations are growing now versus back in 26% in 21. And the median increase for an association in a year is 6%. The report goes on to say, after declines in 2021, and I'm sure you can guess why there were declines in 21 and 22, but after those declines, associations are now rebounding and showing increase in member growth at the highest rate since 2016. So I'm happy to report that our membership has increased by 7.25%. And I don't know why my slides are advancing. I'm not telling them to advance. Something is moving them. Okay. So I'm happy to report that we have increased our membership by 7.25%. We are 1.25 percentage point above the annual median increase of 6% for an association this year, according to MGI Marketing. So a key thought from the report that I also want to mention is one that said forward-thinking associations are redefining their value propositions to ensure their long-term sustainability and relevance. So let's keep that thought in mind as we move into the second half of the content of my presentation in just a moment. Forward-thinking associations are redefining their value propositions to ensure their long-term sustainability and relevance. So let's talk about our future goals and vision. Integrating faith and health and faith, or faith and health in communities is the crux of who we are, and we want to continue to lead the way throughout this nation. HMA should be the premier association for groups everywhere who practice health promotion in faith communities, or hospitals that value the efficacy of faith practices in whole person health. The scope and standards will always be a premier resource of HMA. God has given us the people and the talent to continue as stewards of this publication. And it's time for us to update the health minister's curriculum. New research, new resources, new tools like AI and improved practices abound. It's out there. So we need to convene a team to revise our current document, and you will be learning more about updating this curriculum in the near future. I want us to continue to foster collaboration. We don't want to miss any opportunities to work with other groups who understand the value of this work. We have already begun the work of reviewing and updating our bylaws and our policies, and we'll, of course, see that to completion. And then finally, we need to develop a marketing strategy. We will begin a preamble of sorts to developing a marketing strategy for HMA in the second half of this presentation today. We will start by building consensus around our marketing message, and this marketing message will serve as the foundation for a larger marketing plan that will take us years into the future. So I'm excited about that, and I hope you are too. Regional directors are reporting 125 volunteer hours. Board members are reporting 972 volunteer hours. And, you know, just as an aside, of that, let me go back. Oh, my. As an aside from these two areas where we have volunteer hours, I want to also mention the Lenten book review volunteers who brought us the 10-week book review. They contributed 40 hours of their time. So let's applaud all of the HMA volunteers for the time, energy, and effort that they have put in to do this work. So thank you so much. Thank you so much. Thank you so much. Okay, so y'all already had a sneak peek of my next slides. So, oh, and there's some talking going on there. So what I want to say about our board of directors is that it's an awesome team of leaders in the HMA. And so I want to talk to you about what the tenure is this year and what the need is as we go forward. If you actively participate on any committee within HMA, I consider you a leader in HMA. So from the board of directors to the committee people, to even our executive director, Julie, who is most certainly a committed and talented leader we have come to rely on. Julie has been in the position almost 6.5 years as a paid employee of HMA. Just total hats off to all of these directors. They've been asked to serve 3 years, but many of them have extended their time on the board because they see the need and they are passionate about the work, that not only passionate, but committed to the work of HMA. So I want to fill you in on the status of board members today as it relates to the time they have served and the impending end of their board terms. I want to preface this information by letting you know that we have 2 vacant seats on the board. I'll start with myself. I came on the board October 2020. I extended my service an additional 3 years and will be leaving the board in September 2026 for a total of 6 years. Carrie Moody has served 5 years this coming November and has committed to serving another 3 years as HMA's next president. Woo-hoo! For a total of 8 years. Thank you, Carrie. Terry Helton has already served 3 years come December and will be serving an extra year, leaving the board in December of 26. And Gornick came on the board in January 23 and will be leaving the board in December 2026, serving an extra year as well. Nancy Romanchek came on in May 2024 and is prayerfully considering extending her 3-year term by 8 months. Pam Hurley and Marianne Heisel are in their 2nd year on the board. They're still our newbies. So with the 2 vacancies and then the 3 people rolling off the board in 2026, we as an organization must bring forth more leaders. We need 5 willing vessels, 5 willing vessels. So I know you've heard me repeating several names over and over, volunteers who are working in 2 or more areas wherever there's a need. We really need more people to step up and help us do the work to ensure HMA's continued success in the future. So I did a little figuring. And the average amount of volunteer time for the year is roughly 80 hours. That's only 2 weeks out of 52 weeks in a year. 80 hours spread over 52 weeks. It's just not that overwhelming. And I would venture to say it's doable for most people, So we, of course, appreciate you nominating someone to the board, and you can even nominate yourself. Just reach out to any current board member next week, and we will help you to get that process started. Thank you so much for considering becoming an HMA board member. I wanted to shout out and highlight our newest board member, Helen Bagwandin. She's one of those people who has been working in multiple areas of leadership within HMA. She's been serving on the nominating committee. She's also leads the Southeast regional meetings. So now she's stepped up to accept another role as a member of the board for as of April of 2025. So congratulations once again to Helen, and thank you for your commitment to serve HMA on this level. We welcome her and look forward to her leadership over the next 3 years on the board. So I want you all to feel free to contact me at any time. I'm available to chat about goals, about solutions, about where we need to go, about membership, about leadership. I want you to know that I'm available. Here's my contact information. Feel free to chat it down, jot it down. I really wanted to mention this quote by John C. Maxwell concerning leadership. He says that the pessimist complains about the wind, the optimist expects it to change, and the leader adjusts the sails. And then when I thought about that quote, I said, you know what? True leaders don't complain without acting. And true leaders don't look for things to change without acting. True leaders see a need and they get to work. So thank you so much. I'm going to end this portion of my time, and I'm going to reshare for the second half of my presentation. Bear with me, please, as I work on pulling that up. Thank you so much. Okay, so I'm going to share again. We've done some great work in HMA, let me tell you. We have done some great work. Okay. Okay, so let me get my, okay. We good? Okay, great. So in the second portion of my presentation, I want to do a little bit of consensus building as we prepare for marketing, developing a marketing plan. So in this content portion of my presentation, we're going to be talking about how to achieve lasting decisions. So this is just an introduction to consensus building. There's a larger workshop that we would need to do, or that you can do in your communities if you are interested in doing that. There are many different ways or processes that groups can use to build consensus. So we're going to be doing a modified version of what is known as the workshop method today. And the goal is, as I say, just to kind of pique your interest enough to consider using consensus building processes, especially when tough decisions need to be made in your community groups, in your church, or even in your family. So we know when working in community, it's important that we as faith community nurses and wellness ministers allow the community groups that we work with, the churches and so forth, to have a collective voice in expressing their needs and agency in how those needs get met. Consensus building is a vehicle and method to achieve lasting decisions that have been made by the group who will be impacted by the decision. So that's what's important about consensus building. And remember that that key thought that I'll ask you all to remember, I'm bringing it up again. I want to restate that key thought from that 2023 MGI benchmark report. Forward-thinking associations are redefining their value propositions to ensure their long-term sustainability and relevance. I hope you all are catching the spirit here. I'm hoping that we can move toward accomplishing that in our consensus building workshop today. So our objectives are to discover the pitfalls of majority rule decision-making for problem solving, learn the steps to a conventional problem-solving approach. We're going to be using the workshop method or an abbreviated version, and we're going to do that using consensus building. And participants will practice a consensus building approach pertaining to an HMA issue. So what are the three most impactful messages we can use to market HMA to our target audience, cultivating growth and strengthening leadership? So as we work through this content for our consensus building sessions today, this is the question that we want to keep into focus. What are the three most impactful? So at the end of this session, we're hoping to have three messages that we can use to market to HMA to our target audience that will cultivate growth and strengthen leadership. So let's talk about first the problem with majority rules. Let's talk about how groups come to decisions. So whether we are talking about HMA as an association or your faith community or a collaborating community group or any group where you're seeking solutions or input from stakeholders, there comes a time when decisions must be reached. Let's talk about the challenge related to the majority rules process. This process typically produces opposition within the group, which could lead to dysfunction in the group. So we've all experienced it. A decision is made by a simple majority vote. And then, while it seems fair, it often leaves the group feeling divided. The people on the losing side can feel like their voices weren't truly heard. And that's not the feeling we want to leave with our ministry teams, right? And then when people feel unheard, they may not feel a sense of ownership over the final outcome. And this can lead to instability in the long run. The decision might not have, the full support of everyone. It may not have the full support it needs to be implemented successfully. Even worse, a lack of buy-in can lead to people subtly or not so subtly undermining the decision later on. They might not actively work against it, but their lack of commitment can prevent the initiative from reaching its full potential. The alternative is consensus building. It's not about everyone agreeing 100% of the time, but about finding overwhelming agreement among all relevant stakeholders. Instead of focusing on who wins or who loses, consensus building seeks solid agreement from the parties who are critical to the process or outcome. It's a commitment to finding a solution that everyone in the room can genuinely support and not just tolerate. This approach is what allows us to truly win together. It's not about giving in to everyone's demand either. Consensus is a process of negotiated decisions. It involves active dialogue, a willingness to compromise, a shared commitment to finding a path forward in a way that it works for the whole group. And then the beauty of this method is that it produces more stable and enduring results. When every member of the team has had a voice and feels like their perspective was considered, they are far more likely to get behind the final decision and make it a success. So, consensus building doesn't just happen on its own. To do it well requires a specific kind of leadership. That's where facilitative and servant leadership come in. A facilitative leader doesn't arrive with the answer, okay? They are a process expert who helps the group navigate the conversation, ensuring that the conversation stays on track and that every person has a chance to contribute. And for us as health ministry leaders, this is perfectly paired with servant leadership. A servant leader focuses on the needs of the team first. They model humility. They prioritize the well-being of the group, and they create a safe environment where everyone feels valued and respected. So, as the leader in this process, you are the key to its success. Your job is to ask open-ended questions that encourage deeper thinking and wider participation. Questions like, what are the potential challenges we haven't considered yet? Open-ended questions that lead to conversation. You must ensure all voices are heard. Be intentional about inviting the choir members, the ones who never really say a whole lot. Be intentional about inviting them to share their perspective. Their insights are just as valuable. And it's vital to model active listening. Show your team that you are truly hearing what they are saying by summarizing their points or asking for clarification. This builds trust and shows respect. Finally, you must focus on the group's needs and goals above your own. Your voice and your role is to serve your team and the ministry's mission, not to push a particular agenda. So, believe it or not, there is a biblical foundation for this process, particularly within these types of leadership, facilitative and servant leadership. So our call to unity is not just a good idea for organizational management, it is a core tenet of our faith. 1 Corinthians 12:12 reminds us that we are all one body in Christ with many parts. Just as the body needs all of its parts to function properly, our ministries need every single person's voice and perspective to be healthy and whole. And then the heart of servant leadership is found in Philippians 2, verses 3 and 4, which calls us to count others more significant than yourselves and look to their interests. This is the mindset we must bring to any decision-making process, setting aside our own agendas to genuinely listen and seek the best for the entire group. And a historical example of this is the Jerusalem Council in Acts, the 15th chapter. When the early church faced a major disagreement, they didn't just take a vote. They came together, they listened to different viewpoints, they prayed, and through a facilitated process, they reached a unanimous decision they believed was in alignment with the Holy Spirit. And this is powerful. This is quite powerful. A powerful early example of consensus building. Consensus building in action. So there are 4 steps to the workshop method. The first step is the objective step, or the what. The next step is the reflective step, or the gathering of ideas. And then step 3 is the interpretive step, where we clarify the meaning of the ideas. And step 4 is the decisional step. That's when the matter has concluded and a decision has been made. So here's where you're going to need pen and paper to jot down your thoughts. So grab some pen and paper to jot down your thoughts. I meant to tell you that earlier, but I was having technical difficulties over here, so it slipped my mind. So go ahead and grab pencil and paper to jot down your thoughts. Okay. The first step, the objective step, this is about getting clear on the what. So here's the what for our workshop today. What are the most impactful messages for marketing HMA? Now remember that our target audience, who our target audience is, it's faith community nurses, health ministers, health promoters. Does this feel like a clear and valuable goal today? Just give me a thumbs up if you agree. Is it something that you think we can hash out? What message do we want people to know about HMA? So what are the 3 most impactful messages for marketing HMA? Okay, so now for the reflective step, we're moving into brainstorming, actually. Reflecting, brainstorming, where every idea is a good idea. Take a minute to think about our audience, you know who they are, and our mission. What are some of the key benefits? What are some of the key benefits, key values, or powerful statements you believe would attract new members and strengthen our leadership? In just a few moments, I'm going to ask you to type your ideas into the chat as they come to you. And in this reflective step is where we find meaning in all of our individual ideas. So let's in real time offer those ideas. So here's how we're going to do it. So I want you to do 3 things. The first thing I want you to do is, what do you think are the most important, or what would be the most impactful marketing messages that need to reach people who are not members of HMA? I want you to take a minute, and I'm actually going to put us on a timer. And I want you to take a minute to think about that and jot down on your notes. You're going to hear the timer go off, and you'll be able to share it in just a moment. So you have 1 minute. Go ahead and jot down or think about that. You can jot down on your paper if you need to. Take a minute. About 30 more seconds. Okay, that's our timer. Now, secondly, think about how you can communicate your idea in 4 to 6 words. It doesn't have to be a complete sentence, just a prompt of 4 to 6 words. So think about that. I'm going to give you about 30 seconds to think about that. I know that's a short amount of time, but that's all you need, just to, because you've already gotten your idea. Now, just how are you going to communicate that in 4 to 6 words? 30 seconds. And you might have more than one idea, and that's fine. We want to hear all of your ideas. Okay, that's our time on that one. And then thirdly, the third thing I want you to do is to type your 4 to 6 word idea into the chat. If you have more than one idea, feel free to add it. I'm going to give us a couple of minutes to do that. And then as we're going on to the next step of this process, you can continue to add ideas as they come to you. Are you putting your things into the chat? And guess what I'm going to do? I'm going to display our mission and our vision as posted on our website so that you'll have a basis for your ideas. So just as a reminder, this is our mission and vision. This will help you to create, I'm sure. We're going to be working on our whiteboard now. So I hope Nia has sharing privileges.
I need you to stop sharing so I can pull the whiteboard up.
Okay, I got one more slide and I will.
Okay, thank you.
Okay,
So you have to
that's,
update the screen to the 4th edition.
oh,
Go back, go back.
I just copied it straight off of the HMA website. Yeah. Yeah, we're definitely on the 4th edition. Yay, Nancy. So now we're gonna do the interpretive step or the meaning, which is the grouping of ideas. Nia Davis is here to assist me. She's going to be placing your ideas from the chat onto the whiteboard, and she's going to be grouping similar responses. And I will be asking you if those groupings are congruent. So Nia, have at it. We're going to move to our whiteboard. Bear with us as we make the transition. So happy to get your valuable ideas and input. So I'm going to ask you all not to touch the whiteboard. Just let Nia manipulate it. Feel free to continue entering your ideas into the chat. Don't touch the whiteboard. If this was an in-person consensus building workshop, we would have had more time to navigate through each step with a little bit more intentionality and a little bit more time taken into each of those steps. But I just want to give you an overview or an introduction to how you can use a tool like consensus building, the workshop method. There are other methods as well, to come to decisions in your groups. But because we are on Zoom, just feel free to continue to add your ideas in the chat. Now you can increase the size of the chat window or the whiteboard by placing your cursor on the border that divides the two, and left click to get the double arrows. Then move your mouse to the left or right to increase the size of the chat or the size of the whiteboard. Or you can also increase the size of your own personal whiteboard on your screen by clicking the sizing arrows the sizing icons at the bottom right of your screen, and that'll zoom in on the whiteboard. Because right now I know it looks really small, but if you close the chat, it's going to get larger. Or if you make the chat window smaller, it'll get larger. Or if you go to the bottom of the whiteboard, bottom right, there is a zoom effect or zoom icon that will also increase the whiteboard on your computer for you to see it a bigger or a larger display. So remember, keep the statements brief, 4 to 6 words. And we're going to start grouping some of these ideas. And I definitely need it to be bigger. Okay. Okay, what are some of the ones we're seeing, Mia? Can you okay, so I'm going to let you know what we're seeing. What is the value or benefit? So we need to determine why be a member of HMA. Thank you, Julie. What is the value or benefit? Collaborate with local businesses, healthcare community, public health, public programs. So collaboration. Collaboration with relevant partners. Provide training, CEUs, and support nursing research. Provide training, CEUs, and support nursing research. Now, if you have, differing ideas, do one chat per idea. If you have 2 very different ideas, only put 1 idea per chat, because we're just lifting it off and putting it on the whiteboard, and we want to be able to group them. So, invite churches in our community. Invite churches in our community. So that's collaboration too, isn't it? Wouldn't you agree? That's collaboration, that's networking. Kathleen says, the prophets are here among us. Is that a marketing message that we need to get out? The prophets are here among us. I like that. Julie says, express with other ways God takes care of us through each other. Did I get that right, Julie?
That's a different Julie, I think.
That's Julie Russell.
Julie Russell.
Okay, did I get that right, Julie? Russell?
Yeah, I'm not sure if I expressed it well, but express with others how God takes care of us through each other.
Ooh, that's good. I'm glad I asked for clarification. That's good. I like that.
Those 4 to 6 words.
Yeah, that's good. That's good. That's a message we need to get out there. Okay. Church association collaboration. So I'm hearing a lot about collaboration here in these responses. Faith and health program ideas and resources. Allison, you wrote a paragraph. Allison says, develop membership project to focus on faith community nurses not affiliated with healthcare systems. Yeah.
Well, and Allison, most of us don't have that anymore.
Yeah, they need mentors, guidelines, educational programs. Yes. Then a broad understanding of health, feeding, praying, advocating. A broad understanding of health, feeding, praying, advocating. Thank you, Karen.
What I tried to do with that in 4 to 6 or 10 words was was to help folks in congregations or in the community organizations we're collaborating with to understand that everything we're doing to help people really impacts the broadest sense of health in who we are. And so it's a place where everybody can participate.
Mm-hmm. Okay, thank you. And then Cheryl, meet with community leaders to tell them about HMA. Very straightforward, very direct, very straightforward. Okay. Any other ideas? What are some of the other things or we need to tell people about HMA? What are we saying to the larger society about who HMA is and what HMA has to offer? What are the 3 most impactful messages for marketing HMA? Mentorship program guidance for faith community nurses out of network. Mentorship program guidance. Okay. Wholeness in a fractured world. Collaborating with state faith community nursing associations. That's good too. So we got, it looks like 2 different kinds of collaborations here. Collaborating with other groups that are doing similar work, and then collaborating with groups where we might enlist other practitioners to do this work. Whether it's, starting a ministry in their own faith communities or becoming a member of HMA or what have you. And of course, we do want our marketing message to be a clarion cry in our communities that, hey, this is something that I need to be a part of. A magazine article to promote HMA administered to the network persons involved and their associates. A magazine article, okay? HMA can fill in gaps left by government programs. We can. That would be wonderful. That would be wonderful. So we want to get these ideas down. We are, Dr. Davis is feverishly working at grouping like ideas. And let me read off a couple of more. Collegial input from a broader perspective. Mentorship for health ministers, definitely. HMA serves as a mentor for FCNs and health ministers. Okay. All right, so here's what we're going to do at this point. Feel free to put more in the chat because we're going to save the chat, Terry, Julie. We're going to save the chat. We're going to save the whiteboard. And we're going to continue working on the ideas that you've submitted because every voice is important, has value, and deserves to be heard and respected. So we'll take these, this input, and we're going to group them, as I said before. Then once we've grouped them, we're going to give each group a name. And from those groupings, we will come up with the three most critical or most important, what we feel is the most impactful messages for our marketing strategy. Now, that's going to be based on the fact that several people said it. You know, it's consensus building. It's a matter of hearing many voices saying the same thing. And so once we hear the many voices saying the same thing, we will work around that message. Of course, today's workshop was just an overview, just an introduction, and we can't conclude it here. We can't finish it here, but we can continue to work on it as a board and maybe even have a special time that membership can revisit this. And bring it to a clear close, that last step, the decisional step. So, and maybe we'll do that in a regional meeting. Maybe maybe we can come together in person to do that in a region. So we'll see. We'll see how we can do that. And then finally, Sue has entered another idea, and that is HMA connects local FCN work to wider health concerns and resources. So thank you all for sharing with us today your ideas and your input. We're going to continue to work on this whiteboard. We're going to take your ideas and make it an important, because it is an important part of who we are as HMA. Thank you so much. And I'm done. Thank you, Julie. Thank you, Terry.
Did anybody want to comment or have questions real quick?
We still have time?
You have a few minutes. I'm actually beginning to panic. So.
No, she's on. She's on.
Oh, she is. Julie, you're on?
Yep.
Okay. You all, anybody have any questions? I'll be happy to answer those in the breakout room. I'm going to ask Dr. Davis to come back, and she's my partner in crime with consensus building. She and I learned the different processes of consensus building together many years ago. And so she and I will be in the breakout room later if you all have any questions about how you can implement a process like this in the work that you do in your churches and in your faith communities. Thank you so much.
Thanks, Vanessa. Like a true leader that you are, you really helped us to look at an interesting concept to work within our organization. And I think, or association, I think it'd be great for people to know where we landed, to your point, what the three major consensus ideas that we came up with. So we might be able to, like you said, regional meetings, share it in the newsletter, so I think that would be a really great follow-up to this.
Absolutely,
workshop.
We'll do that for sure.
Very good. Great job.
So now I would like to introduce Terry, who will be introducing our last and final speaker.
No pressure here, Julie. So any Julie who happens to be online. Okay, so the Reverend Julie Morris is a priest in the Episcopal Church who serves as pastor of Mount Cross Lutheran Church in Camarillo, California, thanks to a full communion partnership between the Lutheran and Episcopal denominations. She was ordained in 2001. She has served throughout Ventura County, California, in parish ministry and university hospital and elder care chaplaincy. She earned a Bachelor of Arts in Theology from Loyola Marymount University and continued to earn a Master of Arts in Theology from Boston College, and then a Master of Divinity from Claremont School of Theology. Pastor Julie has been married for over 22 years and has 3 daughters. I actually saw them grow up from tiny to adults. Pastor Julie says that she most values her relationship with God, her marriage and children, her connection to the church, and her relationships with extended family, friends, and the earth. It is a real privilege to welcome my friend and my mentor, Reverend Julie Morris.
Oh, Terry, thank you so much. And I'm sorry for stressing you out. You're like, when is she coming on? Thank you. I leaned on our friendship with the deadlines for this conference. Well, everybody, I appreciate the fact that I am the last person between you and the rest of your life at the end of this conference. So I hope that you will find our 50 or so minutes together to be refreshing and relaxing. My hope is that it'll be a chance for you to breathe, to do a little bit of review of all that you've experienced throughout this conference, and then just to have a sense of what you're going back into life and work with from this conference. But first, I have to say that I am deeply appreciative of your work, your service, your vocations, your ministry. We have a health ministry resource nurse in our parish, and there is not a week that goes by that I don't thank God for her. Complicated medical situations, people that need some guidance about healthcare, home healthcare, end of life, so many things that I am just not fully trained or equipped for. But in partnership with the health ministry resource nurse, we've been able to do some really amazing, caring, healing work together. So thank you for what you do. And I hope that you hear that often in your contexts, but some of you may serve in contexts where you don't hear that. So just hear it from me. What you do matters. It is so important. So thank you. Thank you. I went to a professional conference recently and realized that whenever we do these conferences, to me at least, they feel a little bit like hiking up a mountain. Maybe you have the right shoes on for it. Maybe you have enough water. Maybe the incline is gentle enough that it's a pretty easy hike up to the top. Or maybe you kind of signed up on a whim, aren't wearing the right shoes, are a little bit cold, and find it to be grueling to get up to the top of the mountain. But here we are, really at the top of the mountain, and I saw your schedule. So I see that you had a whole diversity of topics and presentations. Some were really heavy, some were very practical. But in any case, each one brought you up in elevation, right? You're looking at your work, your ministry, your life from a little bit higher up level. And the temptation, there's always 2 temptations from a conference, right? At least the way I experience it. One is that you're kind of watching the clock towards the end and you just can't wait to get back into real life. And everything that is experienced in the conference kind of gets bracketed, maybe put in a file for someday when you'll revisit those notes, but they never really integrate into what you're doing. And the other temptation is to just kind of stay like, oh, I want to stay at this level. I don't want to go back down the mountain and go back to the daily grind. But we want to find a middle way where we both have benefited enough to be here that it's a little bit sad to leave, but also that we're ready, integrating some new insights and ready to hit the ground running with some refreshment and renewed energy and joy and gratitude to be involved in the work that we're in. So that's my hope. I'm going to share a PowerPoint here. Let's see. And Terry, I have my phone in front of me, so if you need to text me for any reason, I'll be watching my texts. Okay. So
You did
that
mark
coming up?
this, you made the sound and the video work, right?
Well, I'm not going to go to the video yet. I just have a couple slides here. So,
Okay.
okay. All right. So, the title that I'm giving this time together is Tapping into the Beauty of It All. A little bit of direction and hopefully a good dose of hope. So, before you come down from the mountain, there's some things that I'm hoping for you, the mountain of this conference. And I also appreciate doing an extended conference over several days where you lean in and you lean out. It's kind of like running up a mountain, going back down, running up a mountain, going back down, right? You're gear shifting constantly the last 2 weeks. So I appreciate that. But I hope that we can look at what kinds of things you can put in your backpack before you go down. First of all, I don't want anyone to leave this mountaintop without experiencing the wonder of this world. So we're going to have a few minutes to just breathe deeply the wonder of this world. Then my hope is that together and on your own, you'll be able to identify some micro practices or micro experiences that you can put in your backpack when you need to access the gifts of a mountaintop experience, when you need to access that feeling of breathing deeply and being part of it all, when you need to access some sense of having colleagues on the journey, when you need to access the source of your calling and your work. And then finally, to decide on just one next step that you can commit to based on everything that you've experienced, discussed, thought about in this conference. So I'm going to stop sharing. For that few 10 minutes of finding awe and wonder in the world, I'm going to share this video from YouTube. It's 10 minutes. And sit back and just get out of your analytical mind and just receive the message and the beauty in this video. Let's see. I think I need, sorry, you guys, I'm a little bit not so adept at this. Let's make sure we have this.
I have it pulled up if you got it.
Oh, got it. Thanks. Yeah. Is it playing?
Not the sound.
It's not. It's not even playing.
Here, pull it down and I'll do it. Sorry,
Okay.
I'll do
Okay,
that for
thanks.
you. I apologize for that, but
Okay, I stopped sharing, right? So you're sharing, Terry?
I'm going to share.
Okay, thank you.
Can everybody hear?
Can you full screen?
If you don't take reality for granted at all, any of the time, then whatever is in front of you is absolutely miraculous, particularly natural beauty.
It really affects me very deeply, looking at the beauty of it all. If you look at a plant, you're not just looking at a plant, you're looking at life and the creation of life. If you study something really, really thoroughly, what happens is you know it intimately and you fall in love with it.
Everything has a strange beauty to it. if you have the right way of looking. When I look at a feather, I see that incredible design, that shape, that pattern, that movement, that flow of life force, that connection that flows through all things.
The human species is in chaos. We've lost a sense of balance and beauty and kindness. And that's because we've lost our connection to the natural world and the natural order of things.
You have to look deeper, and I think that gives you a better sense of an appreciation. You start to see not things in isolation, but things as connected. Well, when I look at a bird now, I don't just see an animal on a branch. I see an ecosystem that's supporting that branch and that bird. Really see it for what it is and marvel at its evolution, because then you get to see its place in the bigger world.
Through understanding and having a reverence for our natural world and understanding its wisdom and its genius, you realize your place.
We're only a very small part of something much bigger, and that's what makes you feel like you belong here.
Nature feels like a portal to me. When I'm in nature, I get the sense of falling through into another place, a more profound and beautiful place.
What I move towards is this sense of wonder in the beauty. And that sense of wonder is what inspires me. I'm inspired by these creatures, and I think that to look at them and to try and connect with them, try to get closer to them through sculpting them, through drawing them, you start to see deeper into what they are.
I've completely fallen in love with reality. Everything you see all the time could be used in a painting or in a story or in a song. The idea that I was trying to somehow match that or somehow capture it in a realistic way is too absurd to contemplate. I feel this urge that I have to express my appreciation for the miracle.
Trying to paint something that you find really beautiful. It is the most creative thing that I
Terry, did it bump us or did it stop your end?
Illustration of my connection to the earth. and you feel obliged to do it justice.
The closer you get to the core of the natural world, the less sense language makes. That's when it's time to be quiet. If you are quiet long enough, you can fall through into a very profound relationship with the natural world.
Just listen, watch, see the wind moving through the branches. That feeds me. And we really, really need those quiet spaces and those natural sounds. It's for our own preservation, if not everything else. When we start to see the value in that, I think that things can really change.
An ideal place is where we are in harmony with all things around us. It's a magical planet. It's a place of incredible diversity. And if we tap into that, we are filled with it. And from that place, you are strengthened. And from that place, you are kinder. And from that place, you're a better person for yourself and for others.
There's a vast, vast treasure trove of reality and nature and gorgeous moments. All the minutiae of interaction, you know, it's all the tiny moments. It's crucial that you do whatever it takes to keep those moments coming.
It's my greatest pleasure to see things. The world that I dream of is the one that we've got, because I think it's absolutely incredible. I'm dying for everybody to see what I see, because it's so wonderful. It's what makes life worth living.
Thanks to all of you who helped make this film possible. All of our films are totally crowdfunded. So if you'd like to continue to
Thank you, Terry. Yeah, sorry everybody for that hiccup, but the sound was beautiful also, and you'll get the link to it, and I hope that you'll have a chance to watch the whole thing and maybe use it in some of your settings. It's a wonderful video. But think about some of the things that you heard there and saw there. That quote at the end, the artist saying that the world that she dreams of is the world that we have, because it's so beautiful and miraculous, right? At the very beginning, deep seeing leads to deep appreciation. Seeing the interconnectedness of it all, the beauty, the miracle of everything, and that we're part of it. We get into task mode, we get into busy mode, we get into overwhelm, and we forget the gift of just being here on this planet, being alive, having our lives intersect with the small amount of people that we get to encounter in our whole lives compared to the vast number of beings who've ever existed. So it is truly amazing. Thinking of nature and the gift that comes from connecting to nature, I'd love it if you'd put in the chat what is within 30 minutes of your house the most beautiful place that you can go. Within 30 minutes, a 30-minute drive. Some of you may want to go to Yosemite all of the time, but where can you get within 30 minutes? The Gulf of America. Where else? Lake Michigan, fall trees on your property, Lake Geneva, Bach Tower. Wendy can get to a state park. Oh, somebody lives on the water, the Mississippi River within 30 minutes. Sabino Canyon, 10-minute drive to the beach. Oh, I once saw a sign that said, if you're lucky enough to live at the beach, you're lucky enough. The Arboretum or your backyard, the Pacific Ocean, Juniper Springs, the ocean view from the cross in Ventura. I know what you're talking about, Julie. Garden of the Gods, somebody's in Colorado. Lake Huron. Look at this. Look at all of this beauty. What an abundance of beauty that this group has access to. Right. Okay, now, what is the most beautiful part of nature that you can either see from where you are right this minute or that is actually in the room that you're in? Okay. Look around. Now, I could just tell you I'm looking out my window and there's about, I don't know, 5 or 6 trees that I can see. But without cheating, I can also hold up this neglected succulent plant that's in my office. What do you have? Flowers in your room, a healthy aloe plant, a rosebud from your rose bushes. Does somebody see the Missouri River from their window, or was that from the previous question? Backyard leaves, 2 puppies, 2 cats, orchids. Yeah, previous question. Okay, Mary, thanks. Kumquat orange and lime trees. An amethyst crystal. Yes. Okay, that's amazing. The Bering Sea, really? Cool. The picture of Jesus going after the lamb. That's in your office. Awesome. Yep. Okay, so now I'm going to ask you to do something that I am going to bet no one has asked you to do yet in this conference. And for some of you, you might be super skilled at it. For others, this might be really stretching you, but there's no grade. Nobody's turning this in. Maybe 1 or 2 people will share, but only if they want to. I would love it if Terry could set a timer for 5 minutes, and then just with a pen and a piece of paper or a pencil and the paper, I want you to spend 5 minutes drawing whatever piece of nature that you've identified is in your office or out your window, okay? And if there's nothing, if there's truly nothing, you will be drawing your own hand. Okay, but I bet there's something. So Terry, can you set a timer for 5 minutes? Right? And the idea here is what you see deeply, you start to fall in love with. Okay, so and you may already be in love with what you're drawing, but what does it mean to see this thing, this being, this creature deeply? Let's spend 5 minutes. Do you know how to do the timer, Terry?
Not on the computer, but I know
Oh,
how
okay,
to watch
but do
the
you have one
clock.
going? You've
I know
got
how
one
to
on your
do-
clock. Okay, so all right, 2:31. 2:31. Draw this piece of nature. Okay, I think that's about 5 minutes.
It
Yeah.
is. It's
Yeah.
close.
Okay, not long enough, but also 5 minutes is a good amount of time too. Maybe it felt a little bit longer if you haven't just sat and focused intently on something. Mine is you can't even see it, which is so good. I hadn't done this yet, but again, my neglected succulent, just spending that 5 minutes paying attention to it, it's wild. Spikes going in different directions, so resilient. This thing hasn't been watered in so long. Hair and fur in places that I hadn't seen. Did anybody else get a little bit of delight or joy or notice anything as they were drawing their little piece of nature?
I actually realized I like odd rocks. And I have a rock that I had never paid, I mean, I paid attention, but I did not realize it had a triangle in the center of it and that the different colors spiraled out.
Yes, I had it. I did not realize. I did not realize it had a triangle in the middle of it. Right. Yeah. So let me get back to my. I wonder if my PowerPoint just froze, if that's the problem. Okay, well, we can do this probably without a PowerPoint. Just, in light of that experience, just listen to a few of the quotes from the video that we heard and saw. If you study something really, really, really thoroughly, what happens is you know it intimately and you fall in love with it. We are only a very small part of something much bigger. And that's what makes us feel like we belong here. And then the artist saying, trying to paint something that you find really beautiful is the most creative thing that I can do to express my thanks for what I see in front of me. And then finally, that sense of magic all around us if we'll let ourselves see it. It's a magical planet. It's a place of incredible diversity. And if we tap into that, we are filled with it. And from that place, we are strengthened. And from that place, we are kinder. And from that place, we are a better person for ourselves and for others. Tapping into it, though, is the secret, isn't it? All of us wouldn't be where we are now if we haven't had some ability to persevere, to be resilient, to meet obstacles and sorrow and desolation without tapping into the beauty of it all. For many of us, probably on this Zoom meeting, that is God, that is the Holy Spirit, that is the creator of all that is. Others may have other names for the beauty of it all, the source and inspiration of it all. But we have to have ways that don't involve going on really expensive vacations or retreats, driving much more than 30 minutes. We have to have ways of tapping into it all on a daily basis. One last quote from that video. There's a vast, vast treasure trove of reality and nature and gorgeous moments. It's all the tiny moments. It's crucial that you do whatever it takes to keep those moments coming. What do you do to keep those moments coming? Think of the little things. I know somewhere in there somebody said that they take a walk every day. we once had a therapist come talk to our youth group, and she said that for however many years old you are, you should be able to list that many coping strategies for stress, you know? So what if I won't make you do this, but I'm turning 55 pretty soon. If I had to write 55 things that I do to keep those moments coming, right? Or however many would you need? 30, 60, 80. How many things can you list in just, a minute? Things, little things that you do to keep those moments coming, to tap into the beauty of it all. Things that you could do on any given day without a lot of money or a lot of time. So make a list, at least 10, everybody. I know you can come up with 10, and then we'll share, but I don't want to even give any examples until you've started making your list. Things that you already do to tap into the beauty of it all, to keep those moments coming. I'm going to see if I can actually get this PowerPoint shared. There we go. So that's what you're doing. You're coming up with at least 10 micro practices or micro experiences that could help you tap into awe, wonder, rest, renewal. When you start to feel yourself wilting or worrying or getting cynical or overwhelmed. Okay. Does everybody have at least 10? I see you're working on it. If you would be so kind to share with your colleagues in the chat, one or two of these micro practices or micro
Hello, Lisa. Are you with me? How come there's only two here? I should watch this. 248. Wendy, I'm going to assign you guys to a room.
Okay, thank you.
Kelly, are you there?
Yes, I went to hit chat and it sent me here.
Well, guess what? I can't see where you're not joined. So we'll make this our room, okay? Because I can't go anywhere. So
Stuck.
You're stuck, and Vanessa's joining us. I don't know why, how that happened.
Yeah, the only thing I
So,
can do is leave the whole meeting.
well,
So-
don't do that. Let's just have our own little room right here. Hi, Vanessa. You can unmute. So, what do you have a special practice that you do?
Oh, actually, I Legos.
You play Legos. That's amazing.
It focuses my mind on something other than everything that's going crazy around me. So that's what I do.
Oh, I think that is incredible. That's that can be a micro moment, even to have a small set. Micro moments that mean a lot to me. I was leaving the church the other day and saw somebody who we have a preschool, and the director was directing about 8, 9 children outside, and there's a little retaining wall. And I watched as a child went to the edge of that retaining wall, just a couple of feet, and proceeded to jump off. And they did it very safely, but I went, that is something a kid loves. And it just made my morning to see that. So those are important things to do. So we're getting a lot of people back here. Vanessa, did you get kicked out?
No, I left the room because I didn't know that I was supposed to be there.
Okay, so you're supposed to be there to talk about micro moments. I think I spread you too fast.
It was so weird because I got put into a breakout room. It wouldn't let me leave, but I didn't know why I was there. It wouldn't
Oh
let
my
me go
gosh,
back.
I did badly. So go back. I'll reassign you and you can say why you're there. It's to talk about your micro moments.
Oh, well, I don't care. I can stay here. It was just weird.
Well, it was my bad.
Yeah. Well, glad you make a mistake or two, Terry. Gives all the rest of us hope.
Oh, so I don't know how to put a message in all of them. I guess I could go visit and say, talk about micro moments. We could bring us back and try it again.
A couple of people are in a room by themselves.
Yeah. So I'm going to close all the rooms and give us another option to do that. It was my bad. Okay, when everybody comes back, Julie, are you back with me yet? You know what? I'll explain when everybody comes back.
No worries, it's fine. Yeah, it's fine.
Are you cold?
I am very cold, yes. And it's actually warmer outside than in the house.
Oh, I know how that works. I live in
Because the
Southern Cal.
temperature changed. But I have a little heater. I didn't see the need to heat up the whole house because I'm in this one room. So I just have my one heater on my Sherpa.
Welcome to how weather works in California. It can be really cold and feel warm
I turned off
outside.
the wrong thing.
Okay, everyone, you probably had that experience of just being like, woof.
Okay, Julie,
and brought into another place. But wow.
There's one way to get your rest and get your awe inspired is to not know where you're at.
Yes, right.
Julie, my apologies.
That's okay.
I did not mean to swish everybody off too soon, and many people did not know what they were meant to do.
Yes.
So that is all of my fault.
That's okay. And I keep getting notices that people are in the waiting room. So I'm just admitting them, but I don't know why I even am allowed to do that.
Because you're a co-host.
Because I'm
a
a co-host.
lot of people got bumped off the
Oh,
whole
okay, friends.
thing and didn't
sorry.
get a breakout. So
okay, so that's frustrating. So this is what we were doing, and we could do it in the chat too. So what are the things that help you tap into the beauty of it all, that center you, that ground you? But they have to be micro. They have to be micro. You know, I used to call them practices, but now I'm starting to call them experiences because I'm starting to notice like this subtle resistance that I have to people who say, you know, you have to have self-care practices. It feels like one more thing to add to my list. But if it's a experience and not a practice, that feels like something that I can receive a little bit more. So micro experiences that just put you in this place of open receptivity to life and to love, to a sense of the miraculous in the world, to God, to your spirit, to your authentic self. So if people could put some in the chat while I share a little bit about what's on my list and what I heard some people say in our group. Silence, even setting a timer for 5 minutes of silence. Listening to birds. And I'm not in a place, I don't think, where we have a lot of birds necessarily, but just stopping and listening for birds. Going on a walk through my really normal neighborhood and touching plants like that I know are fragrant, like rosemary or lavender, and just, you know, rubbing them between my fingers and smelling them. That scent can do it. Watching a nature video, right? And they're so easy. Go onto YouTube, type in nature video, 10 minutes, and you're in like another frame of mind. A TED Talk, if you're feeling like you need some intellectual stimulation, there are so many TED Talks. Just type in, I want to see a TED Talk on, you know, who knows what. I'm lucky enough in my ministry to be to have a preschool on campus. So to just see some of those little preschool faces can be very renewing. Chopping vegetables. If I'm not in a hurry, chopping vegetables for some reason like really does connect me to the wonder of it all. So is there, let's see, I'm trying to get, for some reason my chat, oh, here it is. Okay. Coffee outdoors and praying, yes. Looking at the stars, daily reading, palm trees. Look at that. Jigsaw puzzling, hugging my dog. Yeah. Pulling weeds. God bless you, Terry. I have some for you. Eating chips, yeah. Nancy, I'm right there. Just kidding. Thanks for the humor. Drinking water, connecting with water, right? Water's nature. We have such access to it. Looking at the moon, time with grandkids. Yeah. Okay, good. So my hope was that everybody would have a list of 10 of these. And now you have your calendars. You have your calendars on your phone or on your computer. Calendar 3 of them for next week. Okay, 3 of these micro practices. I want you to actually find a date and a time to do these things. Even if you hug your dog every day and don't think you need to put it on your calendar, actually put it on your calendar for, you know, Tuesday at 6 p.m. or something. Holding a baby. Yes. Savoring food. Yeah. Let food be your medicine, right? What's that saying? We don't want to need medicine for our food. We want our food to be our medicine. Yeah. Yeah. So calendar 3 of those. I know some of you aren't doing it, but some of you are. I see you really like puzzling. Where can you put this? Where can you put 5 minutes of silence, or talking to your roses, or 5 minutes of weeding, Terry, next week, of drinking a glass of water mindfully? All of this is stuff we know. It always, it's always stuff we know, but it's doing it. So just put it in your calendar for next week and see if it might be able to start something. I have a colleague who literally puts in his calendar something about what he's really good. He does it about once a day. He exercises once a day, goes on a bike ride, a hike or something, but in his calendar it says something, so that when people are trying to schedule a meeting for like 1 o'clock on a Wednesday, he'll say, oh, I have something on my calendar. And he does. He has something on his calendar. We need whatever strategies we can to carve out time. So take that one if it helps. All right. Did anybody calendar 3? You did? You did it, Julie? Okay. Super. What else is in the chat? Swimming. Yeah. That's harder to do in 5 minutes, but you could take an hour, even half an hour. Okay. All right. It's close. Our time is over. It is. And we had one other thing that we wanted to do, and that is this conference is coming to an end. And what is one thing that will be your next step based on all the presentations that you heard, all of the discussion groups you were part of, all of the thoughts and the inspirations that came your way? You're going down the mountain and you already have these 3 micro experiences calendared. So you don't have to worry about losing touch with the beauty of it all or losing touch with your inspiration. But what's your next step going to be from this conference? Something you hadn't thought of before, maybe, that you want to implement, or something that you are doing and just recommitting to it. We won't be able to break into a group to talk about it, but if anybody would want to share out loud or put in the chat what they're planning on doing, that would be great.
Julie, one thing I'm planning on doing is we had an amazing speaker talk on parental estrangement with adult children, and it was super powerful and a really hard topic. But I know a family who is dealing with this, and so I'm going to share the resources that I received from Faye, who spoke, and hope that it's just, a smidgen of help for this family and serve as a resource. So that's something
Julie,
that I'm doing.
That is wonderful, right? Like you're being a conduit, right? You receive this and feel like it is just for this family that you've received it, at least. Yeah. Right. Oh, someone's going to start drawing. Yes, that's wonderful. Using consensus building in meetings, right? Rather than majority vote. Learning more about parental estrangement and human trafficking. Okay.
My husband and I have a grief and loss group, and I'm going to use some of these thoughts that you have tap into experiences.
Yes.
When we meet on Monday.
Oh, great.
And just have them to do something.
Yes, good. And Deborah, this video too, can be used if you have ways of showing the videos. It's 10 minutes and it can just really get people to a different place where they need to be. Yeah. Improve my documentation. God bless you, right? Just things like that, that are so important. If you do one thing, it makes it all worth it, doesn't it? Yeah, give out information on human trafficking to your church family, and who knows what lives you will really help and save. What a gift. It sounds like this has been just an experience of abundance, of wisdom, of inspiration, of information. You already sent Mary Beth your parental estrangement tools. To a family member, plan to order them the prayer book. Wonderful, wonderful, wonderful. Okay.
Julie, I'm gonna hug more trees.
Yes, yes, hug more trees, the texture, right? Oh, good. I wanted to share one, this is what we'll wrap it up with, if I can get it up, this last quote. Maybe some of you have heard it before. Let's see if we can get it. It's my last slide. Ah, what is happening? Let's see. There we go. All right, Elizabeth Barrett Browning. Earth's crammed with heaven, and every common bush afire with God, but only she who sees takes off her shoes, right? God has given us these wonderful vocations, and God has given us sight. This doesn't need to be physical sight, although if we have that, thanks be to God, but spiritual insight to really see the beauty, the depth, the miracle of all that is. And so every now and then, take off your shoes. Amen.
Julie, thank you so much. Wow, what a perfect way to end our conference. And I know Terry has sung your praises for quite a while, so we are really privileged and honored that we got to meet you, and not in person, in video, but
in video.
Still got to feel all your gifts and benefit from all your wisdom.
Well, so likewise, I am so in awe and honor and gratitude for all of you for the work that you do in our world, the healing work.
Thank you so much.
Thank you.
I'm just going to wrap up our day today before we flip over to the breakout rooms with our speakers from today. So we want to thank Cheryl, who started us out with a reflection and asked us to clothe ourselves in compassion. The 2025 Norma Small Award was presented to Deb Fell-Carlson. The 2025 Westburg Leadership and Faith Community Nursing Award was presented to Frances Hawkins. Congratulations, ladies. If you read your bios and why you received these awards, they were so well deserved. And we thank you also to the nominating committee. Again, let me know if you are interested in serving in this committee. Bev reminded us why documentation is so important. It ensures continuity of care, facilitates communication, and provides evidence of nursing interventions, and also protects patients and nurses from ethical and legal issues. And of course, the care being done is from a holistic perspective. She also shared integration of AI in practice must not alter the goals of patient care. I really loved that. The hope is that a new documentation tool will be out soon. Vanessa shared HMA's achievements and thanked all involved. We've come a long way. She talked about HMA becoming the premier association for anyone who works in the integration of faith and health. The quote she shared with us is the pessimist complains about the wind, the optimist expects it to change, and the true leader adjusts their sails. Vanessa also gave us an introduction to consensus building. Forward-thinking associations are defining their value propositions to ensure their long-term sustainability and relevance. She talked about leaders that have facilitation and service gifts. We did an awesome consensus building exercise that asked the question, what are the best ways to market HMA, and utilize the steps needed to come to your reasoning. And again, we shared with you that we will be sharing with you also what we come up with. Reverend Julie wrapped up our conference day today and requested us to tap into the beauty of it all. She hopes you're benefiting from the conference and feel ready to initiate some of the things you learned. She shared a video that reminds us to see the beauty in the world around us. Deep seeing equals deep appreciation. We were asked our experiences, and she made sure it wasn't practices, experiences that help us cope, and then encouraged us to literally put them on our calendar. It's all stuff we know, we just have to do it. And I'd like to end our conference today with a quote: "True North is not a one-time discovery, but something you continually return to." Thank you, everyone. I hope that you'll join us in the breakout rooms. If not, we've so enjoyed spending time with you over these 4 days or 4 afternoons. It's really an honor to be a part of this association and to put together this conference for you. So I hope that it was all that you hoped it to be. And again, feel free to get involved in HMA in any way that speaks to you. Thank you so much and have a wonderful evening.